Well, I just wanted to thank you for this invitation to share some information about immunizations. And I'm excited to see some familiar names on the call today, as I spent most of my career in Chinle on Navajo. And so it's really lovely to be speaking with you. I wanted to start out by sharing, let's see, the outline, which I'm going to show kind of where, like now that I'm was in Indian Health Service and in one part of the federal government, and now I've moved to a different part of HHS, a different agency, but to kind of orient you to kind of where I'm speaking from now in this new role, and then to talk some about vaccines for children, which is really like one of the largest budget-wise programs within the CDC, and one that we feel like is incredibly impactful and has relevance for American Indian, Alaska Native children as well. And then some information about immunization trends, childhood immunization trends, especially from during the pandemic, and then program that, or an initiative that we have going on right now to kind of help support improving routine immunization rates. So at CDC, I work within the National Center for Immunization and Respiratory Diseases, and this center has several divisions that focus on the science and surveillance and laboratory work related to specific vaccine preventable diseases like influenza. There's the viral branch does measles and some other viruses, polio. There's bacterial diseases that work on meningitis and then pneumonia. And then the new division for coronavirus and other respiratory diseases. So they do coronavirus and like RSV. But our division, I'm in Immunization Services. Our division is really focused on managing the publicly funded immunization program. The largest part of that is vaccines for children. But there's also some funding that helps cover, like, not completely meeting the need, but helps cover uninsured adult with immunizations, and then also some support for like outbreak risk response for vaccine preventable disease outbreak response. Because vaccines for children is probably our largest, most important program, I wanted to spend a few minutes on this because I know, like when I was working in Chinle, we were a vaccines for children site. We were enrolled in our like different facilities for all sites. But I have a little bit different perspective on the program than what I had when I worked in Chinle. So I thought there might be some things you might find interesting. So Vaccines for Children is having its 30-year birthday this year. And it really is considered the centerpiece of our publicly funded vaccination program, and provides vaccines for over half of all children in the US, and is responsible for significantly increasing vaccination coverage across the country, and has helped decrease racial and ethnic disparities. So really, this is our like key program to address access and equity issues, and it's credited with preventing 472 million illnesses, preventing over 1 million deaths and saving 2.2 trillion in societal costs, which is pretty incredible. So Vaccines for Children came about in 1993, and then was implemented in 1994. And it was in response to a big measles outbreak from 89 to 91. And it was actually, it's kind of incredible to think that, because this I think would be very hard to pull off now these days, but it was established as an entitlement program. The funding came from Medicaid Trust Fund. CDC was delegated the responsibility for managing the vaccines. CMS was delegated the responsibility for providing an administration fee to the providers who gave the vaccine. And then the ACIP, or the Committee on Immunization Practices, determines the VFC formulary, and the describes gives the recommendations for what constitutes routine recommendations. And then the entitlement is to the child. So some of the benefits of the program: it allows children to receive vaccination services in a medical home, eliminates or reduces vaccine cost as a barrier. It helps or allows new vaccines to be provided more quickly than through annual appropriation, incentivizes innovation with price caps on legacy of vaccines. No state contribution is needed for vaccine purchase for children on Medicaid. It helps assure vaccine availability through stockpiles, and it provides opportunities for public health to work with providers on quality improvement of vaccination services. So here's where there's really relevance for you all if you're working in Indian country. VFC program eligibility is for children 0 through 18 years of age who are on Medicaid, who are uninsured, who are American Indian, Alaska Native, regardless of their insurance status, and underinsured. And you can see like the percent of the population at different age groups that's eligible, but basically, over 50% of the population is VFC eligible. So we know that actually, most Indian country, either IHS run tribal healthcare organization or urban Indian organization, that most of those, certainly the ones that provide care to children, are enrolled in the VFC programs through their states. And so that's how they get the vaccine at no cost. So how it works is a healthcare provider, so this is anywhere, healthcare providers can enroll in the VFC program through their state, and then there's some cities and territories, but most places it would be through their state immunization program. Then they can order vaccine. They receive that free of charge. They do have to sign saying they will take responsibility to ensure that appropriate storage and handling, that they administer vaccine only to eligible children. They have to participate in like quality assurance or compliance visits, and participate in quality improvement practices or activities, and complete some annual training. Providers can bill parents for a vaccine administration fee, but they can't exclude a child from receiving the vaccine if the parents can't pay. So the cost is not allowed to be a barrier to receiving vaccine. So the VFC providers are really the key to the success. That's what really creates the access. So it's helpful to have VFC providers, as many people who provide healthcare to children, to have as many of them be VFC providers as possible. So it helps then the kids be able to get vaccines at no cost where they receive care if providers enrolled in VFC. So this is an area that we've really been trying to work on, is to reduce barriers for providers to enroll in VFC programs. And then for an Indian country where, you can, the reason it's important there is because that then that vaccine is available at no cost to the facility. They don't have to purchase it. In the past, individual vaccines were pretty inexpensive, but that is not the case anymore. Nirsevimab is a few $100s per dose. So those costs really add up. So it can be very helpful to the finances of a clinic or facility to be enrolled in VFC. So for American Indian, Alaska Native communities, vaccine is available to children through the Vaccines for Children program. But in addition to that, Indian Health Service is able to purchase vaccine at a federally negotiated rate if they choose to do so. And sometimes they do, depending on circumstances. And then facilities can also purchase directly. But because the VFC is, and then if there are facilities that are tribal communities that don't have access to healthcare or don't have a healthcare facility within the Indian health system, American Indian Alaska Native children can access free vaccine through any healthcare provider that's enrolled in Vaccines for Children by saying that they're American Indian Alaska Native. So it gives some additional flexibility in parts of the country where it may be where Indian health system facilities may not be readily available. They can still get, they don't have to be enrolled in Medicaid, although many may be, but they can still get, are still eligible for Vaccines for Children and can get no cost vaccine. The only limitation would be to be going to a provider that's enrolled in the VFC program. So I think just wanted to make sure that's something that I was not at all aware of when I was working in Indian Health Service, that for kids that have moved off reservation or into cities, that there were these other options available for getting free vaccine. So wanted to share that with you. And then just to let you know that some of the directions we're moving in over the coming year is that we are working to add some different provider types or increase the numbers of birthing hospitals that are enrolled in VFC because of Nirsevimab coming online. So in addition to hepatitis B, like Nirsevimab being so expensive, would be helpful. Birthing hospitals were VFC providers, and to add additional safety net providers like more FQHCs and like rural health centers. And we are updating our provider educational material that we put out there to help provide some best practices, information on best practices for increasing vaccine confidence and then strengthening provider parent conversations about vaccines. We're working with immunization partners and program awardees to identify places within their jurisdictions that have low coverage and determine some strategies for improving vaccination rates. And then we are going to be strengthening the requirements in our cooperative agreement funding state immunization programs, the requirement to engage with tribal communities to improve vaccine access there. That is a requirement currently in our cooperative agreement with states, that they engage with tribal communities, but we're going to be strengthening the requirement so that it's a little less ambiguous, I guess. So I wanted to stop there and just see if anybody had any questions or anybody wanted to share their experience with vaccines for children at their site. And you could either put question or comment in the chat or come off mute and just talk. You all know, this is a yes, no question, I guess. Do you, and I'll ask you just to get a sense. You'll let me know if you are, if your facility that you work with, if it is or is not a vaccines for children provider. Great, great. So everybody that answered looks like is. So that's good to know. That's awesome. Thank you, guys. Okay, cool. All right. So I wanted to talk a little bit about what happened to routine vaccinations during the pandemic. So this is a graph of just in the first few months of the pandemic, what happened to vaccine the orders for pediatric vaccines by week. And you can see within just those first few weeks of the pandemic, the ordering for pediatric vaccines really decreased, which kind of correlates with the decreased number of pediatric vaccinations given during that period of time. So there was this drop off in vaccination of kids in the early part of the pandemic. And those the impact of that decrease in childhood vaccination wasn't the same everywhere. There were in the birth to 24 months, there was a more of a decrease in rural areas, more of a decrease in those living below the poverty level. For kindergartners, there was more of a decrease in the with MMR, and in adolescents, I'll say the HPV has, although some of the others have kind of improved or stabilized, there's two areas where we haven't seen the improvement that we would like, and that's for children living below poverty level, and then also HPV has not kind of rebounded the way we would like to see. And so although early on in the pandemic, there was a decrease in those childhood vaccinations, there were some that actually increased even. And so some of those that have increased coming up to the pandemic were things like flu rates have been improving, rotavirus, hepatitis B are ones where we've seen some real improvements coming up to the pandemic. But then in the coverage has declined among these in the 24 months of age, and particularly in those living below poverty and in rural areas. And so those are populations that we're particularly concerned about. And this is in the 7 series vaccination coverage. So this shows then in the kindergartners, so the slide before was the 2-year-olds, this slide is in the kindergartners and comes up through the 22-23 school year. So you can see pre-pandemic, in kindergartners we have in this country, if you look at states as a whole and the country as a whole, we have very high vaccination rates overall, well, by the time kids get to kindergarten. So which you all know. So during the pandemic and through 2022, those rates decreased coming in, still high, but lower. What is misleading about looking at these overall coverage rates is that it is, although on a whole, it can look okay, but when you look in more localized areas, there can be real pockets of extremely low coverage in certain populations that can create real risk for vaccine preventable disease outbreaks. So all of like a 2% decrease doesn't seem like a terrible thing. It reflects in pockets in certain communities much bigger decreases. So good thing is that we haven't seen a continued decline, and there has been some improvement. Not in 22-23, but we're seeing a little bit of recovery, but we're still not back up to where we'd like to be and where we were. So what we've been seeing this year is globally also, I'm sure you guys have seen in the news that there have been increases in measles cases around the world. And that puts, like, knowing that our MMR coverage across the country is, although still high overall, that we have some communities with extremely low measles coverage. We know that we're at risk for measles outbreaks in those communities. So when there's more cases globally of measles, the way measles was eradicated in the United States in 2000, considered eliminated, and then but so the only way that measles kind of happens in the US is if somebody's exposed internationally and they come in with it. So if somebody is exposed internationally and they come into a community with high coverage, then there may be one or two other cases, but it doesn't result in an outbreak. If somebody gets exposed who's unvaccinated, gets exposed internationally and comes in a community with lower coverage, then there's more of a risk of an outbreak happening. And so that's generally what we've seen over the last 20 years, like where outbreaks occur. It's in very specific communities with a history of low coverage. So that's something that we're particularly concerned about this year, and has led to some advisories on measles vaccination for children who are traveling internationally to get vaccinated at 6 months or older instead of at 12 months. So I wanted to check in and see, like, if anybody had any questions at this point related to measles, or actually my question would be for you guys, like, what was your experience with routine vaccinations during the pandemic? And you can answer in the chat if that makes you feel more comfortable, but did you guys see a drop in the childhood vaccination rates during the pandemic? Mm. And which age groups did you guys see the biggest change in? And has it improved in the last year or two? Are you back up to where you were before the pandemic yet? Not recovered yet. Okay. Well, if things have improved some, but you're not recovered yet, your experience then is in common with much of the rest of the country. So I wanted to talk a little bit, yeah, I see that. So there's, Harry, thanks for that comment. The pandemic did seem to, yes, increase vaccine hesitancy and decrease confidence in vaccines for sure. And that's something I'm very concerned about. I wanted to share some resources with you that now I realize that the data that I shared, like it doesn't reflect, it didn't have any local data, it doesn't have any American Indian, Alaska Native specific data. And the reason that it has no American Indian, Alaska Native specific data is that we have very, that CDC doesn't actually get very detailed data from states that has with the ability to look at we don't get good data on like who's what race or ethnicity. And so although we have little bits, it's in very small numbers and hard to and highly suspect, I guess I would say, because the race ethnicity data that the states collect through their immunization systems is very good. And many states don't have very, complete immunization data in their systems, and not all states share their data with us. So that puts us in a difficult position. Let's see. Okay, so I'm going to talk some about Let's Rise. And this is an initiative that we've put together to just try to provide some additional resources to, the target is mainly state and local health departments, but certainly could be used by Indian country and adapted if it's helpful to make it more appropriate for the population. But the parts of this initiative are to understand the size, scope, and cause of declines in routine vaccinations, to devise an evidence-based strategy and operational plan to catch up, to equip partners with evidence-based strategies, and then to share data to help the jurisdictions, the states that we fund, to help them understand where they have areas of low coverage so that they can focus their attention on those communities. So this effort obviously will work better if we're all working on it together. So we've been targeting health departments, healthcare professionals, other partners, and schools in this effort. And so we've been working with health departments to leverage, to help provide technical assistance to them in leveraging their immunization information systems, or their vaccine registries, to identify individuals and then communities or populations that are behind, and then to promote returning them, having them come back in for vaccination, to make vaccines easy to find and to access, to provide education on giving strong vaccine recommendations, and disseminating information related, vaccine related communications around catch up, and encouraging them to partner with schools and community organizations. We also provide materials directly to healthcare or vaccine providers and healthcare professionals around and providing information on like best practices to improve vaccine coverage. So one best practice I know you all are aware of is sending reminders to families who are behind. I mean, many of these strategies that are, I think, very common in Indian country, honestly, a lot of the rest of the country is still learning to put into practice, or doesn't put into practice yet. So you guys are probably way ahead in terms of, and probably because like if you have public health nursing, I know they work very hard on this. But the reminders to people, the kids who are behind, improving vaccine-related communications, offering vaccine-only appointments, are also another is, vaccinating at any opportunity, implementing systems to make sure that vaccine history is reviewed at every visit, offering strong recommendations, having standing orders, and being prepared to answer questions and concerns. Those are all kind of provider or, provider speaking broadly. And then with other partners, it can be helpful for them to know where to find accurate information. So other public health partners out there, other partners that work with to have them know where to get information so they can share it, to help connect them with the local health department. So they can help with getting the message out about the importance of catch-up and they can help engage with community members, and they could potentially leverage data to focus those catch-up efforts. And then schools are, certainly an important partner to work with. So we do provide some funding to state immunization programs to help support vaccinations in the schools. And I think schools can be a really important partner that way. So they can also help include vaccine information in their back to school communications and help share facts about vaccines, again, send reminders to families. I already mentioned the school located vaccine clinics. And then the last part is those school vaccination requirements. That this is an area of concern because in many parts of the country, those requirements have been sort of are under attack, and more states now allow like non-medical exemptions to vaccines, so that there's higher percentages of kids who have now received exemptions to vaccines. So that contributes to lower vaccination rates for the kids in school. So we have also been doing some large communications campaigns. This is one, this Let's Catch Up is one, and there's some links. We'll share the slides so that you all are able to get the links to these resources. But this this campaign and some others coming out, are nice to be able to use to share with parents and to share with partners, and to share with schools to help with communicating on this. This is fun. So some ways that we're hoping you all will be able to take action are prioritizing ensuring that people catch up, that all kids catch up on their routine vaccinations, helping identify who's behind, encouraging catch up through reminders and recalls and outreach, making strong vaccine recommendations, and then making vaccines easy for everyone to find. And that may mean, depending on where you live, it could be very straightforward, but depending if you're a site or a community that doesn't have access to Indian health system clinic, then knowing where the vaccines for children providers are in your communities would be really helpful. We talked a little bit about this, but we know that in general and in Indian country, healthcare providers, and again, speaking as healthcare providers with a broad definition, are trusted messengers to talk about vaccines. So the ability, you know, to make sure that your providers are confident in talking about it and know the importance of being able to speak confidently with the parent is really important. So all staff play an important role, not just the physician or nurse practitioner. So we want to make sure that staff have up-to-date information. There've been, you know, every year, a number of changes in vaccines available and the vaccine recommendations, and so making sure that that your staff get trained on those the changes to the schedules and the recommendations is really important, and helping them be confident and talking about it. So think about in the patient experience, like each of this, like the encounters, the locations that they're in as they go through the process, and where you can insert steps to help them get vaccinated at each of those. So at check-in and sharing what vaccines they're even better, like even when they're scheduling or in the visit before, you know, the sooner you can let people start thinking about, like, when the child comes back to this next visit, that that they have some vaccines due, and it keeps them from being surprised. So sharing those vaccine information statements and other vaccine information, having materials and flyers available in the waiting room, and then in the exam room, being able to make those strong recommendations, being able to answer questions, being willing to take the time to do that, and having tailored education materials. And then when scheduling the next appointment, to make sure when people are leaving, they know when the next time that, you know, they would need to have vaccines for the next round. The piece on this slide that I know is really, really important in Indian country and valuable, and why there's some very good vaccination rates out there, is the part that happens in the community. So that outreach that's done by public health nursing and CHRs is a piece of this picture that's not reflected on this slide, but I know is very important to that in getting people in for vaccines. So again, trust is the foundation, you know, of these interactions with parents. 93% say their child's provider is the most trusted source of vaccine information. And that trust, you know, really makes a difference in whether somebody accepts getting a vaccine, and building that trust early is important. So some other strategies that I think are pretty commonly in use in Indian country, but making sure you have a reminder recall system in place, having forecasting in your electronic medical record, and having standing orders. And then this is the, we have a Let's Rise. Thanks for sharing that, the link about Let's Rise in the chat, but the Let's Rise webpage has some good information out there in the Let's Catch Up communications campaign. So there's some other resources, and again, I'll share the slides. One of the key takeaways that some groups of children fell behind on routine vaccinations during the pandemic, but it's not too late to protect our community, and that routine immunization catch-up is a goal that we can achieve by working together with policymakers, health departments, healthcare providers, and school leaders as trusted community messengers. And that's, you know, and many other partners in the community as well. So I think we have time for questions.
Okay. Thank you, Dr. Moses, for your support and work. If anyone has any questions for Dr. Moses, please raise your hand, or you can type the questions in the chat box and I can read them off. So I'll give you time to do that now.
Some things I'd be really interested in hearing from you all about is like what you have what strategies you've found helpful in improving immunization uptake or coverage in these last couple of years, and if there are areas of need that you've identified, ways you think that the CDC could be helpful in your communities, improving vaccination coverage.
Anyone want to share their stories? Okay, I guess there's no questions. I can share some announcements. So thank you today for attending today's webinar. Please complete or I guess we have one from Harry. He states, one of the most effective things I have found to improve childhood immunization coverage is to simply point out to facilities their vaccination rates and how they compare to averages. And Michelle states, it's so important to approach the parents as a team with the same messaging to the families. And Patricia states, I am new to this clinic and not sure how / if we dropped off. Many of our children see providers outside of our clinic, and we rely on IHS to identify those who need reminders.
Patricia, what state are you in?
New Mexico.
Yeah, they have a good. Mhm.
Yeah, we are a small reservation in the middle of nowhere. And so there are they can either go to Albuquerque, which is a little further away, or they can go to Socorro. And so a lot of our kids do that. And being new here, my plan is to try to get more of those kids to come here for their immunizations.
You know, if you're the state IIS, the immunization registry data, do you have a way does that get uploaded into your electronic health record?
It does not. We don't have that interface. So everything that we do has to be put in there manually. So we're just hoping that other places that they do go for them are keeping them up to date as well.
Yeah, that is a helpful step, but it's
Yes.
complicated to accomplish for sure.
And Kimberly stated, I think some of the CDC trainings like the Pink Book should be required, obviously determined by the employer in order to keep up to date.
Great resource.
Kimberly, I'm going to post a link. Do you mean this Pink Book course? Book on epidemiology of vaccine preventable diseases? And then Harry states, on an individual patient basis, though, I have found it challenging in the past 3 years to deal with the misinformation and disinformation about vaccines.
Yeah, I appreciate that comment. I think that has gotten harder, and I think that can sometimes it's really like not a thing that can be accomplished in one visit, or like the first try, but that sometimes just but it is a different approach. I know that in the past, like the CDC has really advocated this like strong recommendation, like just kind of presuming that somebody will want to get the vaccine, and this is really important, and then that'll be enough. But I think now being open to like hearing people's questions and concerns and what their fears are, and not necessarily expecting to achieve success in the first encounter, but like taking the time take over time, hopefully being able to build some trust. But it is much more challenging these days. And remember, guys, that that vaccine, the anti-vaccination movement is highly, highly funded. And even though it's not a lot of people running it, but they have a lot of money these days. So a lot more than they used to. They're well funded. It makes it very hard for us and government agencies to counteract.
And Brushana, sorry if I'm butchering your name, states, coming from a self-governed area, we have utilized our ability to bring patients in by offering incentives. In our community, this has worked well. However, I know this strategy will not work for other areas. Did you want to comment on that?
Yeah, I find that so you feel like that's been helpful, incentives? It's good to know for others that are in self-governing areas. It's great that you're able to do that.
And Darla states, curious about best practice messaging ideas for school required versus optional vaccines such as MMR versus HPV.
Yeah, gosh, I feel like I've had to evolve when it comes to, I used to really feel like these things just need to be required. That's the answer, is like mandating vaccines. But that, I think during the pandemic, it was pretty clear that can't be the first option. That's only really effective if a community is ready to accept that. And if they're not, it can having required, doing the mandates for vaccines can kind of backfire. So that's what's happened in different parts of the country where they have these, non-medical, now allow non-medical exemptions to vaccines, and that's only increased. So, I think that, I these days tend to de-emphasize. I think it's fine to, let people know what's required, but that's not gonna, if somebody's skeptical about vaccines, having that vaccine be required by the state is not necessarily enough to convince people that it's important. And so that means messaging, convincing people in other ways. And it comes, I think it comes down to those conversations where people get to ask their questions and express their fears and have somebody listen to them. And then that may take multiple conversations.
Kimberly put a link in the chat on the Pink Book series, which has 18 webinars. There's no registration process to view the sessions. The link to each course can be accessed on or after the indicated date, but that provides a good webinar series that people can watch. It's targeted towards physicians, nurses, nurse practitioners, pharmacists, PAs, medical students, state and local immunization programs, and more. So thanks, Kimberly, for that. And here,
I'm sorry, I wanted to mention another resource that an issue that I think we have not paid enough attention to, and that is that a significant portion of kids, and then therefore parents, have a lot of fear about just getting shots. And immunize.org, which is a great, I'm sure you guys already use them as a resource, but immunize.org has put a lot of effort into developing some material to help make the whole vaccine experience less scary. And they have stuff tips and tricks that are age appropriate. And so I would recommend checking out immunize.org and what they have to kind of reduce vaccine anxiety, because sometimes that's the barrier, not just, lack of confidence in vaccines.
And I put that link in the chat.
Mm.
Harry has stated an authoritative approach does not work. I totally agree with you with what you're saying. Patience and being willing to listen are key. That's great advice. So, at this time, I would like to state some announcements for NIHB, and thank Dr. Jill Moses again for collaborating with us on this webinar, and thank you for your support and the continued work that you do, especially what you've done for Indian country. So thank you. So now I'm going to talk about some